If you watched the movie Jawan, you've probably noticed Sania Malhotra's character, that of a doctor. The film also draws an eerie connection to the Gorakhpur case of 2017 with this character, wherein the government is portrayed as the scapegoat for something they weren't exactly guilty for. But let's step back from the silver screen for a moment. The reality of Uttar Pradesh today is quite different from the glitz of Bollywood. In fact, it's surpassing states like Kerala, Punjab, and even Tamil Nadu in some aspects. Consider this. Not too long ago, UP faced a staggering 655 fatalities due to the Japanese encephalitis. It was a healthcare crisis that rocked the state for decades. But fast forward to 2023 and you shall be amazed. The journey of UP's medical Kaya Kalp is nothing short of a miracle. The number of encephalitis fatalities has plummeted to zero. You heard that right? Zero. So welcome aboard and let's take a closer look at UP's remarkable medical transformation. We'll explore the factors that contributed to this turnaround and why it matters not just for UP but for the entire country as well. So sit tight as we delve into the real life story that's even more gripping than a Bollywood blockbuster. Today Uttar Pradesh has achieved what once seemed impossible. In a recent statement, Chief Minister Yogi Adityanath proudly declared, in the current year between January 1st and September 7th, no one has died due to Japanese encephalitis, chikungunya or malaria. The disease wreaked havoc in the state for 4 decades and the state government has successfully controlled it within 5 years. What makes this achievement even more remarkable is Yogi Adityanath's willingness to acknowledge the mistakes of past administrations, including his own. He candidly admitted that the turning point in the battle against Japanese encephalitis came after the tragic Gorakhpur case. This was when Yogi Adityanath had barely assumed power as the chief minister in March 2017. In 2017, following the Gorakhpur tragedy, his government established an interdepartment committee that brought together experts from various fields. This collaborative effort marked the beginning of a multi-pronged approach to tackle the disease. As we dive into the statistics, the progress becomes even more evident. From January 1st to July 31st, 2023, Uttar Pradesh reported a mere 17 cases of Japanese encephalitis. Astonishingly, not even a single life was lost to the disease during this period. This sharp decline in fatalities paints a picture of a state on the path to complete victory over a once debilitating ailment. But UP's transformation doesn't stop at healthcare. It's also emerging as one of the fastest improving states in India in terms of medical infrastructure. The state government has made substantial investment in healthcare facilities, ensuring that residents have access to quality medical care. However, the journey Uttar Pradesh embarked on wasn't a cakewalk by any stretch of the imagination. Just as Chief Minister Yogi Adityanath and his administration managed to curb the menace of rioters posing as anti-CA activists, the COVID-19 pandemic came knocking on India's doors. People looked at UP with a mix of anticipation and suspicion. After all, the state had a rather notorious healthcare record, almost on par with Bihar. Yet by 2021, many strategists and policymakers had to admit, albeit reluctantly, the efficient administration of Yogi Adityanath when it came to handling the COVID-19 pandemic. Consider the second wave of COVID-19, which was way deadlier than the first. In terms of healthcare infrastructure, the United States stands leagues ahead of India. Still, during the peak of the second wave, the US witnessed a staggering death rate of 1800 to 2100 deaths per million. In stark contrast, UP recorded a mere 47 deaths per million during the same period, despite the pandemic hitting nauseating peaks with over 3 lakh cases per day. At a time when states like Maharashtra and Kerala, with their supposedly superior infrastructure, were struggling to cope with the basics, UP, despite limited resources, outperformed most Indian states in both COVID cases and subsequent vaccinations. At a time when states like Maharashtra and Kerala with their supposedly superior infrastructure were struggling to cope with even the basics, Uttar Pradesh, despite limited resources, outperformed most Indian states in both COVID case fatalities and subsequent vaccinations. Chief Minister Yogi Adityanath's leadership and governance played a pivotal role in UP's remarkable COVID-19 response. He pointed out once, the population of Australia is around 30 million and in India, houses for 30 million poor people have been built in the last few years. India also provided free ration to a staggering 800 million people during the pandemic, more than the combined population of all the countries in America and the European Union. When even countries like USA and Australia are compelled to acknowledge your measures, you've undoubtedly achieved something of great worth. UP's journey from a state with a notorious healthcare reputation to a COVID-19 success story is a testament to the power of effective leadership, resourcefulness, and resilience in the face of unprecedented challenges. It serves as an inspiring example for regions far and wide, demonstrating that with the right strategy and determination, even the toughest battles can be won. Today, the health infrastructure of Uttar Pradesh stands as a formidable force to be reckoned with. This transformation has been propelled by the unwavering commitment of Chief Minister Yogi Adityanath, who has made healthcare one of the top priorities for his administration, apart from law and order and infrastructure. As we look back to 2017, we find that only 12 districts at that time had state medical colleges. Fast forward to 2022 and UP is set to embrace 14 new medical colleges by the end of the financial year. But that's not all. The state has also been busy enhancing healthcare facilities at the grassroots level. This includes the establishment of RT-PCR labs, CT scan units, dialysis units, and more at the district level. Furthermore, UP has embraced the public-private partnership model with 16 PPP medical colleges, 2 AIIMS institutions, and the emergence of 30 private medical colleges, all contributing to bolstering the state's medical services. Under Chief Minister Yogi Adityanath's visionary leadership, not only has the state managed to curb the spread of the coronavirus, but it has also witnessed significant growth in its medical infrastructure. The policy of one district, one medical college has been actively pursued. Additionally, super specialty blocks have been introduced in the medical colleges of 5 districts, namely Gorakhpur, Meerut, Prayagraj, Kanpur, and Jhansi. The expansion of medical education has been equally impressive. A total of 938 MBBS seats and 127 PG seats have been added in the state medical colleges of late. In the private sector, 1550 undergraduate seats and 461 postgraduates and diploma seats have been increased. What was once a scarcity of medical professions is now turning into abundance, with plans to double the number of medical seats in the next 5 years. This includes 7,000 seats for MBBS, 3,000 for PG, 14,500 for nursing, and 3,600 seats for paramedical courses. The Yogi government's efforts have ushered in a golden era for healthcare services compared to previous administrations. But the commitment to improving healthcare doesn't end there. The UP government has been diligently working on enhancing rural healthcare infrastructure. The number of community and primary health centers has seen significant growth, with 29 new community health centers in the works, bringing the total to 937 across the state. Furthermore, 3691 primary health centers are currently operational, ensuring that healthcare is accessible even in remote areas. To bolster the rural health system, the National Health Mission has allocated funds for the establishment of new community health centers, primary health centers, sub-centers, and health and wellness centers. This strategic approach aims to ensure that sub-centers serve a population of 5,000, primary health care centers cater to populations exceeding 10,000, and community health centers are established for larger populations. Additionally, there are plans to open 100-bed hospitals to address serious medical cases effectively. To be honest, Uttar Pradesh's healthcare transformation under CM Yogi Adityanath is nothing short of remarkable. The commitment to improving healthcare services is not just a promise but a reality that benefits millions of people in the state.